Welcome dear students. Under the course name Determinant of Quality of Life, name Concept of Human Health and Hygiene. Content included in this module is Introduction of Human Health, Determinant of Health, Health Indicators and Management, Hygiene, Definition and Importance, the role of hygiene in disease prevention, the link between hygiene and mental health, community and government strategy, conclusion and learning outcomes. Learning objectives of this module is the session will cover the definition, dimensions and the key principles of health while emphasizing the importance of hygiene practices in preventing disease and promoting well-being. Students will also explore public health policies and practices that aim to improve health outcome globally. Understand the multi-dimensional concept of human health, comprehend the various factors that influence human health, gain insight into personal and public hygiene practices for disease prevention, learn how health and hygiene practices contribute to well-being at individual, community and global level, develop the ability to critically analyze health related issues and hygiene practices in contemporary society. Introduction to human health. Now, first of all, we discuss about the definition of health given by the World Health Organization. Health is not merely the absence of disease or infirmity, but a state of complete physical, mental and social well-being. Holistic health model recognize the interconnectedness of physical, mental and social health. Dimension of health is physical health, means the state of body and its ability to perform function optimally. Example, cardiovascular health, immunity, blood circular system, etc. Mental health, psychological well-being, including emotional regulation, mental resilience and cognitive functions. Social health, the ability to form satisfying interpersonal relationships, adapt to social environments and contribute to the society. Spiritual health, a sense of purpose and meaning in life, which may or may not be associated with religious belief. Determinant of health is biological factors, that is genetics, age, sex and inherited conditions influence health status. Behavioral and lifestyle factors, diet, exercise, smoking, alcohol consumptions and stress management. Social and environmental factors including education, socio-economic status, housing conditions and social support networks. Healthcare access, it means availability and quality of healthcare services including preventive cares, diagnosis and treatments. Policy and government interventions, public health policies, regulations on sanitations, vaccinations, programs and health awareness campaigns. Health indicators and its measurements is first is life expectancy, an important measure of population's overall health. Infant mortality rates indicate the quality of health care and living conditions our children. Disability adjusted life years, a measures to the overall disease burden expressed as the number of years lost due to ill health, disability, or early death. Global health threats. The impact of global issues like pandemic, chronic disease, example obesity, diabetes, and environmental changes on human health. Hygiene. Definition and importance. Hygiene. Personal hygiene refers to the practices that individuals follow to maintain cleanliness and prevent illness in their own self and their surroundings. It involves maintaining bodily cleanliness, that is bathing, brushing teeth, and etc., and hygienic habits, that is washing hand, using clean water, etc. Environmental hygiene refer to the maintenance of cleanliness in the living environments, including the home, workplace, and public spaces. This includes waste disposal, pest control, sanitation, and clean water access. Public hygiene involves practices aimed at ensuring the health and well-being of populations, such as sanitation systems, water purification, and health education campaigns. The role of hygiene in disease prevention. Disease as in infectious disease, waterborne disease, and vector-borne disease. First of all, discuss about the infectious disease. Poor hygiene is a major risk factor for the transmission of disease like cholera, typhoid, and tuberculosis. Personal hygiene practices like hand washing are crucial in preventing the spread of these diseases. Waterborne disease. Contaminated water, a significant source of disease such as diarrhea and dysentery. Proper sanitation and access to clean drinking water can prevent these conditions. Vector-borne disease. Hygiene also plays a role in controlling diseases transmitted by vectors such as malaria and dengue, which can be mitigated by controlling mosquitoes and maintaining clean surroundings. The link between hygiene and mental health. Hygiene and self-esteem. Self-esteem is a part of mental health, and psychological well-being is the part of mental health. First of all, discuss about hygiene and self-esteem. Personal hygiene practices contribute to an individual's self-image and mental well-being. Poor hygiene can lead to feelings of isolation, stigmatization, and low self-esteem. Psychological impact of hygiene in communities. Clean living environments promote mental well-being by reducing stress and fostering a sense of control and stability. Hygiene practices for health maintenance. First of all, personal hygiene practices. Hand hygiene, oral hygiene, body hygiene, menstrual hygiene, and nail and care hygiene. First is hand hygiene. Washing hands with soap and water is one of the most effective methods of preventing the spread of infections. Oral hygiene, brushing teeth regularly and visiting the dentist to prevent oral diseases like cavities and gum disease. Body hygiene, regular bathing and wearing clean clothes to prevent skin infections and body odors. Menstrual hygiene, proper management of menstrual health using sanitary products and maintaining cleanliness to prevent infections. Nail and hair care, cutting nail and keeping hair clean to avoid infection and improve personal appearances. Environmental hygiene practices, including waste disposal, water hygiene, pest control, and air quality. Waste disposal, safe disposal of waste, both solid and liquid, to prevent the spread of disease. This includes proper sewage management and garbage collection systems. Water hygiene, ensuring access to clean water and safe drinking practices such as boiling water or using water filters. Pest control, eliminating breeding ground for disease vectors like mosquitoes and rodents to prevent the spread of diseases. Air quality, reducing exposure to pollutants, ensuring good ventilation and reducing indoor air pollution. Example from tobacco, cooking fumes, etc. Public hygiene practices including sanitation system, vaccination, health education and food hygiene. Sanitation system, ensuring access to public restroom, clean public spaces and proper waste treatment systems. Vaccination, the role of immunization in disease prevention and promoting public health. Regular vaccination program protect population from preventable diseases. Health education, public health campaigns aims at educating people about the importance of hygiene practices in disease prevention. Example, hand washing campaign, safe water uses. Food hygiene, safe food handling and storage practices to prevent foodborne illness. This include proper cooking, refrigeration and hygiene in food preparation area. Health and hygiene challenges. Now, discuss in next slide. Global health and hygiene challenges. Included these challenges is access to clean water, sanitation and waste disposal, hygiene and health disparities, and climate change and hygiene. Access to clean water. Despite progress, access to clean water remains a challenge for many communities, especially in low-income countries. This issue exacerbates the spread of waterborne diseases. Sanitation and waste disposal. In many parts of the world, inadequate waste management system lead to environmental pollution and health hazards. Hygiene and health disparities. Socio-economic inequalities affect access to basic hygiene resources. Vulnerable populations such as the poor and marginalized groups are at greater risk of poor health outcomes due to lack of access to hygiene products or services. Climate change and hygiene. Changes in climate patterns can exacerbate water shortages, increase the spread of vector-borne diseases, and challenging existing hygiene infrastructure. Emerging disease and hygiene practices, that is included pandemic and hygiene, antimicrobial resistance, that is MR, global health policies. Pandemic and hygiene. The COVID-19 pandemic demonstrated the critical importance of hygiene in controlling the spread of infectious disease. Regular hand washing, mask wearing, and social distancing become essential hygiene practices during the pandemic. Antimicrobial resistance (AMR). The overuse of antibiotics combined with inadequate hygiene and sanitation has contributed to the rise of antimicrobial resistance, making it more difficult to treat infections. Global health policies. International organizations like the WHO and UNICEF are working to improve hygiene practices globally, particularly through initiatives focusing on sanitation, water, and hygiene. WASH. Strategies for improving hygiene. Discuss under this. First of all, personal strategies. That is include education and awareness, promoting the importance of personal hygiene through education at school, workplace, and community center. Developing healthy habits, encouraging individuals to integrate hygiene routines into their daily lives, such as regular hand washing and maintaining oral health. Community and government strategies. Investing the sanitation infrastructure, government should invest in creating and maintaining sanitation system that ensure the public has access to clean water and safe waste disposal. A public health campaign by government and community is running national and local campaigns to educate the population about hygiene practices and impact on health. Global strategies, including the collaboration and aid, research and innovation. Collaboration and aid. Collaboration between governments, NGOs, and international organizations to improve global health outcomes by increasing access to hygiene resources in underdeveloped regions. Research and innovation. Encouraging research into innovation solutions for improving hygiene practices such as low-cost sanitation system or hygiene education technologies. Key takeaway. Health is a multidimensional concept and includes physical, mental, social, and spiritual well-being. Hygiene plays a crucial role in disease prevention and maintaining overall health. Effective hygiene practices require a combination of individual responsibility, community efforts, and government actions. Learning outcome of this module is student will understand the concept of health and its various determinants. The student will be able to apply the principle of personal, environmental, and public hygiene to prevent diseases. The student will analyze global challenges in health and hygiene and propose sustainable solutions. Thank you. That slide is presented by Dr. Poonam Singh Kharwar, Assistant Professor, Faculty of Education, Banaras Hindu University, Varanasi.